Sound should not be a problem here. Hi, good afternoon. Today we will get to know more about lung surgery, the intricacies of lung surgery, the indications, the problems which one can face after lung surgeries, and what can be the solutions. Lung is a very beautiful organ. Actually, we all live and breathe through it. The most important thing one has to understand is it's a very common organ to be affected because we get exposed to so many viruses, bacteria, fungus, and then you have problems because of that. Now, one of the important thing is we have to understand when to operate and how to operate. So when is a lung surgeon involved? To be honest, the lung surgeon is involved only in a very specific set of indications. For example, if the medications don't work with with the physician guys, and then you have something like a pus in the chest, when you have air in the chest, when you have a lung which is damaged by a fungal infection, a bacterial infection, or a viral infection, or if there's a cancer. Sometimes in our country, we usually see something called as tuberculosis, which is very common in our country. And tuberculosis has a wide array of complications which can happen to the lung. Tuberculosis affects lung mostly, although it affects other organs, but lung is most commonly affected. And it can be a wide spectrum of conditions which can happen because of tuberculosis, starting from tubercular effusion, that is water getting clogged in the chest, the water getting infected, that's called empyema, tubercular empyema. Then there can be lung disease itself, lung again getting infected because of the tuberculosis. Sometimes there can be a blowout of the airway causing a bronchopleural fistula. Sometimes there can be a fungal infection which develops, that's called as fungal ball, and it's called aspergilloma generally in our setting. So that is one of the most common presentation. The other settings, other complications can be tubercular airway blockage called stenosis. There can be destroyed lung. Lung can get completely destroyed, or a part of lung can be destroyed. There can be bronchiectasis of the lung, and sometimes you can have very bad infection called as multi-drug resistant tuberculosis or non-tubercular mycobacterium. These are two of the most extreme conditions which can affect the lungs, where patients can suffer, and then ultimately when the lung gets destroyed, a surgery is mandated to such conditions. We can talk about lung cancers, which is one of the most common scenarios in our center where we operate for them. Lung cancers can be of multiple types. It can be the normal, regular squamous cell carcinoma or adenocarcinoma. Then there can be carcinoids. Then there can be mucoepidermoids, glioma, sarcomas. A wide array of tumors can affect the lung. And when they affect the lung, if it's operable, that means if it's confined to the lung and nowhere else, then we do something called as a lobectomy. Now, when you say lobectomy, the lobectomy any lung surgery can be done in three different ways. In general, the most common ways of doing it is by either by robotic, by video-assisted thoracoscopic surgery, or open surgery. Now, open surgery is a time-tested old method, but the thing is we have evolved from open to minimal invasive. So, of course, we will want to see if there are minimal invasive options for lung. Definitely, there are many, and the most common ones are video-assisted thoracoscopy and robotic, which are the two main procedures which we do. Now, when we talk about open surgery, the open surgery also has some place. For example, if there's a very big tumor, about say 8 to 10 centimeters or more, open surgery is preferred. If there is a heart vessel which is involved, if there's a vessel close to the heart which is involved, again open surgery is necessary. If the if the patient is not fit for some kind of robotic or minimal invasive procedure, then open surgery has a place. Now, rest everything can be done by robotic or video assisted thoracoscopy surgery. VATS is as simple as laparoscopy in the chest. Everyone would have heard the word laparoscopy, but very few would have heard the word VATS. VATS means laparoscopy in the chest. It's video assisted thoracoscopic surgery. So it's very simple. It's to remember. It's called VATS, and this is one of the easiest way to do the procedure. And with time, we have realized that anything which can be done by open can be done by robotic or VATS. Any tumor, any location, any kind of disease can be treated by this. Now, there are a few questions which have been popping on my screen. I would like to take them. What are the common signs that indicate a lung or chest problem? So now, the most common symptom which a patient would come to us is cough. Unrelenting cough is the most common symptom. Now, if the lung is affected, then you have sputum, then you have shortness of breath. If a large part of the lung is affected, then you have shortness of breath or dyspnea or inability to breathe. These are the most common symptoms. Now, sometimes you have tumors which can bleed. There can be an airway tumor which can bleed. There can also be some fungal infection which can bleed. So that is one of the most critical symptom which definitely warrants something major is going wrong. When there's blood in your cough, that's a bad sign. You should take it very seriously. So the next question is, I'm a smoker. Can you tell me any medications to get rid of smoking? Okay. Now, smoking de-addiction centers are flourishing all over the country. And honestly, anyone who is smoking and needs help, we can provide that help. I won't suggest any medications as such, but there are many kinds of therapies, and we have medications also, but that's part of the whole treatment we give, and it's not just one isolated thing. We can just, I can't suggest a medication, but if you're planning to de-addict yourself, you should come to us. Can a person live a normal life if part of the lung is removed? Very good question again here. So we do, like, say, about 30 to 35 lung resections a month. So we do about, like, say, that's about, if you calculate an overall about 300 to 400 surgeries a year, lung surgeries. I mean, talking about lung removals. So what we have realized is, when you remove a part of the lung, if the other part of the lung is working well, generally there is no problem. They live a near normal life. Now, in certain rare scenarios where the whole lung has to be removed, not rare in the sense we do almost one a month, where we go and remove the whole one side of the lung. What happens when one side of the lung is removed is, if the other lung has already compensated well, these patients do pretty well without any major issues. Now, I have patients who I'm operated 5-6 years back who are coming to me now. They're living a very fulfilling life. Some people have become doctors. Some people have gone on to have kids. Some people have lived a new life. They're starting going on trekking, and they go to exotic places just to see if the lung is tolerating well or not. So, very important question, but genuinely they can live a normal life after a part of lung is removed. Okay, there's another question. There's a good list of questions here. So, can non-smokers develop cancer? Yes, there is a risk of lung cancer in non-smoking patients also. See, one of the things which in India we generally notice is females developing cancer because husband is smoking all the time, and this female is not avoiding, just being a passive smoker. She can be a very, very high risk for lung cancer. Now, other conditions like some gas exposure, radon gas exposure. Some patients have asbestos exposure. The pollution itself is so high. We have seen this phenomena earlier, a decade back in China, when Beijing was highly polluted, and they had high incidence of lung cancer. Now the same thing I hear from my friends in Delhi. Back then, when I was there in Delhi, also we could see that the pollution is very high. Now I'm hearing that the incidence of lung cancer is getting higher. The more and more cases of lung cancer are coming to them for surgery, and I'm sure the same will be there in Hyderabad in 10 years. And there's no difference in any of the metro cities in our country. So all of them almost are living in the same kind of this thing. So we expect definitely higher chances of lung cancer due to pollution. So yes, the question was, can a patient with non-smoker can have lung cancer? Definitely yes. Will breathing become difficult after lung cancer? Of course. See, lung cancer, if detected early, if it's small, You may get away with nothing. You may get away with one surgery and then you can live a normal life. But in case if it's already spread, or if the big its tumor is big enough to cause you breathlessness, that means you're looking at something more conservative treatment. That means it's either chemotherapy or immunotherapy or a combination of both. So if you have any symptom, try to sort it out as early as possible. Go to a physician. Go come to us. We will take care of it. So the next question is tuberculosis still a major health concern? Yes, very pertinent question actually, because the government is talking about eradicating tuberculosis by 2025. That was the earlier goal, but we are very far from reaching that goal. In fact, there was a sudden spurge of cases after the COVID pandemic, because many people were sitting at home and they were not getting treated, and then they were affecting the other family members. So there has been a substantial increase in tuberculosis cases after COVID. The detection has been higher. So we are not nearly anywhere near the eradication thing. Now, the other thing is, I am getting patients who have been affected by tuberculosis 20 years back. 20 years back, they were affected, not taking treatment well. They have developed some problem because of that in the lung. Now they're coming for surgery to me. So at least I think next 15 years, we'll still have all sorts of TB problems coming to us for some sort of surgery to us. So the next question is how to prevent surgery. If you don't fall ill, we don't operate you. Very simple. The thing is, it's not really in someone's hand to prevent surgery. Yes, you can take measures to improve your health. Okay, so regular exercises, pranayam, deep breathing exercises, avoid smoking, avoid alcohol, non-processed food, exposure to harmful gases, workplace changes, pollution. All this can be avoided, which can help you be a healthy person and avoid. That's how you can avoid a lung surgery. How do I know if my lungs are healthy? That's a good question. The thing is, it's there are certain set of parameters. I'll talk about clinical this thing. So if you're a young guy or an old guy or whatever age you are, if you're able to climb two flight of stairs without any problem, that means you're doing pretty good. Okay, if you're able to do more, that means your lung performance is better. So what we generally ask the patient is to see how much they can walk in 6 minutes. Generally, that's what we say. You walk for 6 minutes and see how much distance you're covering. If you're able to cover a good amount of distance in 6 minutes, that means your lung is in good shape. If you're not able to cover 360 meters or less, that means your lung is not good. You have to get more evaluation done. This is generally a small test which you can do. Anyone can do at home. Now, the thing is, if you come to the hospital, then there is something called as pulmonary function test. There's BLCO, there's CPET. There's a battery of investigations which we do based on the requirement. So if you ask me, you just walk for 6 minutes, put a clock, and then see if you can walk more than 360 meters. Generally, they are pretty okay. How long does it take to recover from lung surgery? Now, this is a very important question because, see, lung surgery has evolved significantly over the last decade. Before, even when I was training in AIMS New Delhi, the concern was, okay, he's going to undergo a lung surgery and he may live for 2 weeks or 3 weeks in the hospital. But now we don't need an ICU for 95% of our patients who undergo surgery. We don't need any ventilator for 99% of our patients, because only 1% of the patients need a ventilator. And very rarely, 99% of our patients go home in 3 days. Only rare cases stay back if they have a complication of some sort. So now you understand the lung recovery is much, much faster. Many of my patients come from Central India and other parts where I tell them, you get a surgery done today and next week you're going home. So that's the kind of change which has happened in the last decade. And it's not just the surgical aspect, it's the anesthesia aspect, the ICU aspect, the hospital aspect. When you have a great team of people who understand what is your goal, they work together and give the best benefit to the patient. So the next question is, due to other after effects of smoking, I got to know that I got asthma. May I know if this asthma is cured completely? Okay, so the question is very pertinent. So the thing is, what happens is, whether when you're diagnosed as asthma, we have to see what is your response to biologics. Okay, today, in today's era, there are multiple treatment options for a case of asthma. I would suggest you come to us. We can evaluate you, or you go to a nearest pulmonologist and have a look at him. Get yourself evaluated and see what is the kind of asthma you have, what is the level of obstruction you have, what is the restriction you have, and then we can plan your medications properly. Of course, asthma is very much treatable. I can't say it's curable, but it's very much treatable. What causes collapsed lung? That's the question that's been asked. Now, the lung can collapse due to various reasons. One of the things is if there is an airway tumor. Okay, that means there is a this. What happens when does a lung collapse is when there is air not getting into the lung. The air generally comes from our nostrils and then goes into the neck. Then there's a trachea. In the neck, there's some organ called trachea, and the trachea goes down and then divides into left and right bronchus, and then that goes into the lung. This is the way of normal air to pass through. Now, obstruction at any point can cause collapse. For example, if there's a tumor, if there is a mucus plug, that means the phlegm is not coming out, and that becomes a ball of mucus inside the airway, that can cause obstruction. There can be a tumor. There can be a narrowing of the tube itself. The airway can itself become hard and narrowed, so that's called as stenosis. That case also, you can't have any airway clear. So these are the main causes for collapse of the lung. The next question someone has asked me is, Mr. Tej has asked, is hyperhidrosis curable? Cure is a very tough word for hyperhidrosis, but yes, it is treatable, very much controllable. So we have the latest surgical technique, which is non-cutting, daycare, non-intubated VATS sympathectomy, where patient comes home the same day, goes home the same day, and we just clip the nerve, and it has worked wonders to me for all my patients. We have done about 100 now, and most of the patients have very or no compensated hyperhidrosis. So I'm very happy with the technique, and it's really very, very helpful for patients. Who should undergo lung cancer screening? That's a very important question. So now we generally consider any smoker who has smoked for more than 20 years, 20 pack years is what we say, is a candidate for lung cancer. Now there are patients who have smoked for 30 years, but they have smoked less, also can be candidates for lung cancer screening. Now, the other set of patients who are suitable for a lung cancer screening is if there's a family history of lung cancer in any of the family members. And these are the main indications for lung cancer screening. Now, in our center, we have something called as a nodule clinic, which is very well run by our pulmonology team. And what we have done is we have created something called as a nodule loop. So there's a nodule which is detected on CT scan. We do biopsies. The pulmonologists do the biopsy, and then they refer to us. And within a span of 15 days, we're able to give you a nodule, complete the nodule loop by operating them and giving them the cure. So that is something which we have done at Yashoda very successfully. Now, if a patient undergoes a screening, the advantage of screening is it's a low dose scan. You don't be exposed to much of radiation, so you can easily recover from it. Now, who next? I'll ask the I will answer the next question. Aparajita Chaudhary has asked, how do doctors decide whether lung surgery is necessary? Now, the lung surgery will be necessary when there is a lung which is damaged and which cannot be managed by medications. Or, for example, if there's a lung which is completely destroyed and it's not helping in any breathing, but it is causing persistent symptoms like cough, hemoptysis, blood in the sputum, cough, phlegm, and fever. That means that lung is destroyed and it's acting like a source of infection. Now, that is an indication for surgery. Okay, so infections and tumors, these are the main two subset of conditions where lung surgery is needed. So I spoke about infections. The next set of indications is tumors. Any tumor which is there in the lung, if it's not medically managed, generally we prefer doing surgery for lung cancers in the early stage if it's operable. If it's beyond an early stage, then we do something called as neoadjuvant. Then what we do is we give drugs to reduce the size of the tumor and tumor burden and then operate. If the tumor is spread to multiple places, then that patient will not be a candidate for surgery, will be a candidate for chemotherapy. Now, there are other conditions where lung surgery is needed. For example, there is air in the chest. That's called bulla. There's a term called bulla. That means the lung has become weak, and then there's a balloon which is formed within the chest. Now that balloon ruptures, and then there is air everywhere. It will press on the heart, it will press on the lung. That is another indication for surgery commonly. Then the other set of indications are effusions. Lung is fine, but there was some pneumonia in the lung because of the various reasons. And then the pleura doesn't work, and then there's pleural fluid which is stuck, and there are multiple pockets which are formed. That is one more indication for lung surgery. Next question is, what lifestyle changes help lung cancer patients recover better? Oh, this is a very important question, because what happens with many of our patients are they are smokers, they come with lung cancer, and then they say, can I keep smoking now that I've got lung cancer? It's very funny when they ask me this question, but I would recommend the day you can stop smoking is the day you're going to improve your lung function. And it's not about lung function on that day itself. It's about the improvement you see after in the recovery phase also. Now, lung cancer, maybe you got a lung cancer because of smoking. If you keep smoking, you can have esophageal cancer, you can have stomach cancer, you can have oral cancer. There are umpteen number of cancers which can happen because of smoking. So I would suggest you not to smoke. And that is one of the most important changes you should do for a better recovery. Then you have to have more of physical training, physiotherapy, and respiratory exercises to make you recover faster. Now, is vaping safer than smoking? No, that's not the way it is. We have seen that both vaping and smoking. In fact, there was a recent study on weed, because many people, they have this misconception that, oh, I don't smoke cigarettes, but I smoke weed and I don't get lung cancer. But there has been a recent study which shows that, okay, if you smoke weed, even you are susceptible to lung cancer, because ultimately what's happening is you are getting affected by it. Your lungs are getting affected by it, and there's a mutation which causes cancer. Why is a PET scan done? What is a PET scan different from CT scan? Okay, so now PET scan and CT scan are two different things, actually, to be honest. And PET scan is a nuclear medicine study where we use something called as FDG. FDG is a fluorodeoxy phosphate, and that for glucose, which is used as a molecule. What we do, we inject in the intravenously in the IV, and then it circulates along the body. And wherever there are cells which are high in glucose, that cells take up this, and then there'll be a lightening of the lesion. Their lesions light up, and that's what we see on the scan. Now, CT scan is just computer tomography, where it's like a combination of multiple X-rays which are put together and done a scan. So there are two different aspects altogether. Yes, both are helpful in our management, because if there's a doubt in lung cancer, generally we do a PET scan to see if there's any uptake, and also to see if there's any uptake anywhere else. If there's any uptake anywhere else, that means the cancer has spread to some other place. So, again, another question is hookah safe? No, hookah is neither hookah nor smoking nor weed. Nothing is safe. What do lung cysts or lung nodules? When do lung cysts or lung nodules need surgical removal? Now, there's a very good question. Actually, if there's a lung cyst which is asymptomatic and less than 3 centimeters, I would prefer to wait and see if there's any symptoms which cause. For a lung nodule, anything more than 8 mm needs to be biopsied. I'm not talking about surgery, but I'm talking about getting to know what is it. So any lesion which is 8 mm or more, we generally ask them to undergo a biopsy to find out what is it. If it turns out to be a cancer, then we do something called as segmental resection. It is not a lobectomy. We do a part, very small part of the lung is taken along with the lymphatics, so that we can give a cure for the patient. That is what it is. Then broken ribs are damaging lungs. How to treat them? Okay, so we spoke so much about lung and pleura and everything. I will briefly talk about fractures, rib fractures. Rib fractures are one of the most common injured organs in a road traffic accident or in any sorts of accident. Now, rib fractures generally don't need surgical management. If it's a single rib or two ribs, it doesn't need to be fixed. Now, when are the indications to fix it is when you are not able to get him out of the ventilator because of the flail segment. What is flail? Flail is when we take a breath, the chest wall will come out, and when we leave it, the chest wall will go out. In when you take a if flail is such that the ribs are broken at multiple parts and in two different parts. So that has become a separate entity. It is not breathing along with the chest wall. It is a separate entity and it's not helping in any breathing and it's preventing lung to expand. So if that is the case, you go in and do the surgery. That is one thing. Other thing is if you have blood within the chest, which is a lot of blood is accumulated and you have to clear all that, then that is an indication for surgery. There are more if the lung is pressing onto the heart, if the rib is broken and pressing onto the heart, lung or liver, then that is an indication for surgery. Then we have conditions where the rib has been shattered completely, although there is only two ribs, but it has shattered completely, and there is herniation of the lung. That is another indication for surgery. So these are the conditions where broken ribs have to be fixed. Nicotine gums can be an alternative option definitely to stop smoking. There's a question asked. I think yes, that can be used sometimes. Can lung cancer always be treated without surgery? Sorry, Dr. Aparjita, I have bad news for you. Lung cancer, the main curative, if you talk about curative, what is the curative management for lung cancer? That's only one thing, that is surgery. Everything else is palliative. Can lung surgery be done if the function is poor? Can the lung function improve with exercise? See, Mr. Danish, this is a good question. Actually, the lung function can improve if the underlying lungs are good and they are not put to the best effort. Sometimes what happens, we see that their lung is already damaged because of various reasons. Some can be COPD, ILD, or various reasons, where lung itself, the intrinsic capacity of the lung has gone down significantly. If that is the case, then the lung function won't improve with just a surgery. Lung function will improve after lung transplant. So if the lung is not functioning well, both the lungs are not functioning well, if there is problem, then he is a candidate for transplant. What are the side effects of lung cancer treatment? Lung cancer treatment, there are, first I will tell you briefly that what are the treatment options we have. If the tumor is smallish, there is no lymph node, then he'll go for surgery. If it's biggish tumor, there is lymph nodes more than 5 centimeters, then we give something what is neoadjuvant chemotherapy. That means we try to reduce the tumor size by giving chemoimmunotherapy. Then once the size is better, then we operate. Then the side effects of that can be chemotherapy related or immunotherapy related. Same, all those things you know about, the GI disturbance, hair loss, infection, chance for infection. All these things are very common with chemotherapy and immunotherapy. Now, other than that, you can have problems because of surgery. Once patient undergoes surgery, then if the other lung is not doing well, you can have problems of breathlessness and dyspnea. So these are the things. There is one more question. What are the early signs related to smoking? Do I need to take any test? Yes, if you're a smoker and if you're a chronic smoker, you need to understand one thing, that you have to undergo an evaluation. If you're smoked for more than 20 years, I would suggest you to undergo a low dose CT scan where in a center where generally lung cancers have been detected and cured well. How soon should surgery be done in case of infections where medical management is not helping? Does timing of the surgery make any difference? Mr. Danish, that's an excellent question. If, for example, if there's an infection like empyema, and if he comes to me and generally they ask this question, can we wait for a little longer? I wouldn't suggest anyone to wait for surgery if there's an empyema, because it will only make surgeon's life difficult and your life difficult if it's a very thick pleura, and the more thickness you develop, the more trouble you'll have. So better to get it done early. I think this may be one of the last questions I'm going to take. We're running out of time. What is the success rates of lung transplant? Okay, very good question, Mr. Ishwar. The lung transplant success rates overall in the world are somewhere around 80%. We are still a little less than that, but still we are still doing pretty well. We do about something about 60% to 70% success rates. Now, the reason why lung transplants fail in many times is because of the infections or there's rejection of the organ. So this is a very important discussion to have. And I think we'll next time maybe we talk about only lung transplants, because I think it's going to be there are going to be questions to be asked on that. And in view of time and some other commitments, I think we'll have to close this chat. But I will be always available to solve your questions through the Yashoda link. Anytime you can just message me and we can sort out all your questions. Thank you.